we've moved on. I'm starting to feel a little more comfortable. I'm going to get some of my questions answered. We're in just your basic exam room.
Right. There's a lot of rooms like this here, but this is one of our exam rooms where we have an x-ray box. We have some chairs for, as usually, mom and dad are here. Sometimes the athletic trainers are with us. And then I take a history. We try to go to speed that's right for everybody. But I want to take a look at their knee, and what I can get from a physical exam is a lot.
Even before you touch?
Even before I touch them, many times I can know whether they've torn their ACL or not. And then we confirm things by a physical exam, looking at the amount of swelling, look at the amount of play, and there's some very specific parts of the physical exam of the knee that will give me that information.
So in here, we're going to get the history, and I always
and the physical exam.
And the physical exam. But any information that people have and can write down, and that's going to help you, and then you have the physical exam. So we've done those two things, and now, do you know at this point whether an MRI is necessary or not?
Yes, yes, and generally we do get an MRI. We don't do that in every instance, but generally we do. The process is that we generally get the MRI, then the patient sees me even in the same week. We can get an MRI most of the time within 24, 48 hours. We have a team here that right from here, their MRI is scheduled before they leave the office, if that's what's indicated. And they then know when their MRI is going to be and when their follow-up is going to be, because then we can discuss that. And I give them some things to think about and ask them to write down their questions, so when they come back, they have their punch list, because again, they're nervous, and they can make a list. We can go over those things in detail and then work out a game plan.